If you're new to working in healthcare, you may be feeling overwhelmed by the complexities of medical billing. There are so many different rules to properly code for the services you provided so that you can get paid. One of these is the 8-minute rule. This applies to time-based Current Procedural Terminology code, also known as CPT codes. Providers that offer direct contacts for patients, such as physical therapists, are familiar with these time-based codes. But calculating the total amount of billable units can be confusing. Hi everyone, I'm Matt from eTactics, and today I'm going to share everything you need to know about the 8-minute rule. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. For providers that offer direct contact treatment, there are two distinct ways to bill for codes. The first uses service-based codes. Each service-based code can only get billed once per visit, regardless of how long the treatment lasted. The second type is time-based, which uses the 8-minute rule. There's a slew of CPT codes that get billed for in 15-minute increments. Sounds self-explanatory, but these are time-based. So what the heck is the 8-minute rule, and how do you apply it to codes that mention 15-minute increments? Medicaid uses this rule as a guideline for providers. Private insurance companies that follow Medicaid's guidelines use the 8-minute rule as well. But not all insurance payers use it. Therefore, it's important that you check with the payer if they have a requirement for a different way to calculate billing units. Now let's go over how to actually use the 8-minute rule. Since some codes mention billing for a procedure using 15-minute increments, you might be wondering what to do if it was shorter than that. That's where this rule comes into play. The 8-minute rule says that if a service lasted at least 8 minutes, providers can bill for 1 unit. Once the treatment lasts through 22 minutes, in other words, 8 minutes more than the first 15-minute increment, then the provider can now bill for 2 units. Here's a visual to help make more sense of this. If the service length is 8 to 22 minutes, the provider bills for 1 unit. If it's between 23 and 37 minutes, they bill for 2, and so on. Now this continues until the health professional accounts for all of their time. Here are some examples to make this easier. If a physical therapist offered a time-based code for 7 minutes, they cannot bill for that procedure because it isn't equal to or greater than 8 minutes. But let's say they offered a service for 33 minutes. This gets billed at 2-minute increments since it's between 23 and 37 minutes. But what if you provided both of these services? 7 plus 33 equals 40 minutes. Shouldn't that be 3 units? There are 3 minutes left over from the 33-minute service plus the shorter 7-minute service. By Medicaid's guidelines, you could include that combined 10 minutes as a third billable unit since it's greater than 8. You would bill this under the larger of these two codes, and in this case, the 7-minute service. However, there is one problem. Private insurance payers typically don't allow for mixed remainders. If that was the case, that extra 10 minutes wouldn't get billed. You'd only bill for the first 2 units from the 33-minute service and not include the 7-minute procedure. What if you provided service-based and time-based procedures to the same patient within the same visit? You would still add your time-based units using the 8-minute rule. The time spent on the service-based codes would not get figured into the total. After calculating the time-based units, you then add a single unit for each service-based code. Regardless of how long those procedures lasted, each service-based code only gets billed as 1 unit. Without proper coding, claims would just end up getting denied and you won't receive reimbursement. It's that simple. This is stating the obvious, but that's not something that you want. Health professionals that have direct contact with patients provide 2 different types of procedures: service-based and time-based. As if coding wasn't already complicated enough, each of these follows different billing rules. Hopefully, by now you have a better understanding of how to effectively apply the 8-minute rule for time-based units. Calculating these total units ensures that you don't leave out any billable time or don't bill for too many units. If you'd like to learn more about medical coding and billing practices, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below. What are you waiting for? Subscribe to our YouTube channel.